Have you noticed your legs feeling heavy, swollen, or tingly as you get older? Maybe walking feels harder than it used to, or your feet are always cold. If you're over 60, these aren't just annoyances, they could be signs of poor blood flow that can affect your whole body, especially if you have diabetes. But what if I told you there's one simple exercise you can do at home in just a few minutes a day that can dramatically improve circulation in your legs, reduce swelling, and make walking feel easier again? Stick with me, because I'm going to show you exactly how to do it safely, why it works, how it can transform your leg health, even if you've struggled with circulation for years. As we get older, one of the things that often goes unnoticed until it starts causing discomfort is the way blood flows through our legs, and this is something that becomes even more critical after the age of 60. Our bodies are amazing at adapting over time, but certain systems naturally start to slow down, and circulation is one of the most important. When blood isn't flowing as efficiently, your legs are the first to feel it. You might notice a heaviness, like your legs are carrying a little extra weight, or a tingling sensation that seems to creep in when you've been sitting for too long. Some people describe it as a sort of dull ache, while others feel coldness in their feet or swelling around the ankles. For many older adults, this is just brushed off as getting old, but it's actually a signal from your body that it needs a little help to keep blood moving properly. And when you have diabetes, these issues become even more important because high blood sugar over time can damage both nerves and blood vessels. This combination makes your legs more prone to poor circulation, meaning they may not get the oxygen and nutrients they need to stay healthy. You may notice that injuries, even minor cuts or scratches, take longer to heal, or that cramps and fatigue seem to appear out of nowhere. All of these things are connected to the fact that your blood isn't circulating as efficiently as it should, and that's why paying attention to leg health becomes so important after 60. Poor circulation can also increase your risk for more serious problems, such as peripheral artery disease or even blood clots, because when blood pools instead of flowing freely, it creates pressure and strain on your veins. Many people don't realize how much everyday movement or the lack of it affects circulation. Sitting for long periods, sleeping with your legs bent in uncomfortable positions, or avoiding walking because of joint pain all contribute to slower blood flow, which in turn causes that heaviness and tingling we've been talking about. Over time, this can make walking feel more difficult and even limit your mobility, which is why acting early is so valuable. Fortunately, the good news is that circulation is something you can actively improve through targeted exercises and habits that strengthen the muscles responsible for pumping blood back to the heart. By understanding how aging and diabetes affect your veins and arteries, you can take simple, practical steps to support your leg health, reduce discomfort, and regain energy and mobility that may have started to feel out of reach. The exercise I want to focus on today is something that might sound almost too simple to be effective, but the truth is, it's incredibly powerful, especially for people over 60 who are dealing with circulation issues or diabetes. It's called the seated calf raise, and unlike many exercises you might see in the gym or on social media, it doesn't require fancy equipment. It doesn't put stress on your knees, hips, or back, and you can do it right in your living room or even while sitting at a table. What makes it so effective is that it targets the muscles that act like pumps for your blood, specifically the calf muscles. These muscles are literally responsible for helping push blood back up toward your heart, and when they're weak or inactive, blood can pool in your legs, causing that heaviness, swelling, and discomfort that so many people over 60 experience. The seated calf raise works both the gastrocnemius, which is the larger outer calf muscle that most people are familiar with, and the soleus, which is deeper and plays a critical role in circulation. Many traditional exercises focus only on the gastrocnemius because it's visible and gives shape to your calves, but the soleus is the muscle that really matters for helping blood flow in older adults. The beauty of the seated calf raise is that by keeping your knees bent while lifting your heels, you activate the soleus in a way that standing exercises often don't, making it a much more efficient way to improve circulation. Doing the exercise is straightforward. You sit on a sturdy chair, keep your feet flat on the floor about hip width apart, Lift your heels slowly, while keeping the balls of your feet on the ground. Hold at the top for a couple of seconds, then lower them back down with control. It's important to focus on slow, controlled movements rather than rushing through reps, because the squeezing and releasing of your calf muscles is what actually encourages blood to move through your veins and back toward your heart. One of the biggest advantages of this exercise, especially for older adults, is safety. Standing exercises can be risky if you have balance issues, arthritis, or weak knees, but doing the seated removes that risk entirely, so anyone can do it without fear of falling or hurting themselves. Another reason it's so effective is that it can be done anywhere, anytime, making it easy to turn into a daily habit. Whether you're watching TV, waiting for your coffee to brew, or even sitting at your desk, you can do a few sets of seated calf raises and immediately start activating the muscles responsible for pumping blood through your legs. For people with diabetes, this is particularly valuable because improving circulation helps reduce swelling, decrease fatigue, and support nerve health, making your legs feel lighter and more comfortable. Over time, just a few minutes a day can strengthen your calves, enhance blood flow, and help prevent some of the more serious complications that come from poor circulation, all without putting your body under unnecessary strain. One of the most important aspects of this exercise, and really any exercise for improving leg circulation after 60, is proper technique and consistency. And this is where a lot of people tend to miss out. You could do the seated calf raise every day, but if you're not doing it correctly, the benefits will be limited. Slow, controlled movements are key, because the way these muscles work is very specific. They need to contract fully to squeeze the veins and help push blood back to the heart, and then relax completely so the blood can flow back in and refill the vessels. If you're bouncing your heels up and down or rushing through the reps, you're not giving your muscles the chance to do their job, and the circulation improvement is minimal. Think of it like a pump. The squeeze pushes the blood, the release allows it to return, and both parts are equally important. Holding the lift for a count of 2 at the top might seem like a small detail, but it's exactly what makes the exercise effective, because it ensures the muscle fibers are fully engaged and giving the veins a proper push. Another part of proper technique is posture, which is often overlooked but makes a huge difference. Sitting up straight, keeping your core slightly engaged, and placing your feet firmly on the floor ensures that the muscles are aligned properly and that the force from the calf contraction is transferred efficiently. Slouching or leaning back takes tension off the muscles and reduces the effectiveness of each rep, which is why paying attention to how you sit is just as important as lifting your heels. Consistency is the other crucial factor, and it's where most people struggle. Doing the exercise once a week won't give your calves the stimulation they need to strengthen and improve blood flow. Like any muscle, the calf needs regular, repeated activation to respond. Ideally, performing a set of 10 to 15 reps 2 times a day allows the muscles to build endurance gradually without overexertion. Over time, as your calves become stronger and more responsive, you can increase the reps or even hold the lift slightly longer to continue challenging the muscles and enhancing circulation. Another tip is to pair the exercise with gentle breathing. Inhale as you lower your heels, exhale as you lift. This rhythmic breathing supports oxygen flow to the muscles and complements the pumping action, making each rep more effective. The amazing thing is that with proper form and regular practice, people often start noticing improvements in leg comfort, reduced swelling, and less fatigue within just a few weeks. The muscles that were once weak and inactive gradually start doing their job again, helping blood circulate efficiently and supporting overall leg health. This combination of correct movement, posture, breathing, and daily practice is what makes the seated calf raise so powerful. Why it's considered a cornerstone exercise for improving leg circulation after 60, especially for those managing diabetes or other age-related circulation challenges. One of the most remarkable things about the seated calf raise is how it targets both major calf muscles in a way that many other exercises simply don't, and this makes it especially effective for people over 60. When we talk about the calf, most people immediately think about the larger muscle on the back of the leg, the gastrocnemius, which is the part that gives your calf its shape and is often the focus in traditional workouts. But there's another muscle called the soleus, that lies underneath the gastrocnemius and plays an even more critical role when it comes to circulation. The soleus is the muscle that's primarily responsible for helping pump blood back up to the heart from your lower legs, and as we age, this muscle tends to weaken more quickly than the gastrocnemius. That's why exercises that focus only on standing movements or jumping tend to miss this deep muscle, leaving circulation issues largely unaddressed. The seated calf raise is perfect because it keeps the knees bent, which is exactly the position needed to fully engage the soleus. When you lift your heels while sitting, the soleus contracts and squeezes the veins, creating a pumping effect that literally helps push blood upward, counteracting the natural slowing of circulation that comes with age and conditions like diabetes. Another advantage is accessibility. You don't need a gym membership, heavy weights, or complicated equipment. All you need is a sturdy chair and a few minutes of your day. This makes it easy to incorporate into your routine without having to rearrange your schedule or worry about overexerting yourself. For older adults, this is especially important because exercises that are too strenuous or require balance and mobility can be intimidating or even dangerous. The seated calf raise removes those barriers entirely, providing a safe way to strengthen the muscles that support circulation. You can even do it while multitasking, watching TV, reading, or even chatting with family. The convenience factor makes it much more likely that you'll stick with it consistently, which is where the real benefits come from. Over time, as you perform these raises regularly, both the gastrocnemius and soleus become stronger, your veins become more efficient at moving blood, and you start to notice improvements in leg comfort, energy, and mobility. The pooling and heaviness that once seemed inevitable begin to fade, and your legs feel lighter and more responsive. For those managing diabetes, targeting the soleus is particularly valuable because it helps reduce the risk of complications like swelling, slow-healing sores, and nerve discomfort. The combination of strengthening both calf muscles, improving circulation, and making the exercise accessible and safe for daily use is what makes the seated calf raise so effective. It's not just a small tweak or a temporary fix. It's a strategic, targeted movement that addresses the root cause of poor leg circulation and gives your body the tools it needs to function better even as you age. By consistently engaging the soleus and gastrocnemius, you're literally teaching your legs to pump blood more effectively, which supports overall leg health and can make a significant difference in how your legs feel day to day. While the seated calf raise is incredibly effective on its own, pairing it with healthy habits can amplify the benefits and help maintain long-term leg health. And this is especially important for people over 60. One of the simplest yet most powerful ways to support circulation is staying properly hydrated. Water isn't just essential for overall health. It actually helps your blood flow more smoothly through your veins and arteries. When you're dehydrated, blood can become thicker and more sluggish, making it harder for the calf muscles to push it back up toward the heart. By drinking enough water throughout the day, you're giving your circulatory system the fuel it needs to work efficiently alongside the exercise you're doing. Nutrition is another critical piece of the puzzle. Eating foods rich in antioxidants, healthy fats, and potassium can strengthen blood vessels, reduce inflammation, and support overall vascular health. For example, fatty fish like salmon, fresh fruits and vegetables, nuts, and whole grain all contribute to keeping your arteries flexible and your blood flowing freely. When you combine this with the mechanical pumping action of the seated calf raise, you're addressing circulation from both inside and outside the body, which is far more effective than focusing on one approach alone. Movement throughout the day also plays a huge role. Even if you're doing your seated calf raises, remaining sedentary for long periods can still slow circulation. Gentle walking, stretching, or light leg mobility exercises complement the seated calf raises and keep blood flowing continuously. Think of the calf raises as a focused boost for circulation, while daily movement keeps your veins and arteries active between sets. For people with diabetes, these combined strategies are particularly important. Diabetes can lead to reduced blood flow, nerve damage, and slower healing. So supporting circulation through multiple avenues is crucial. By exercising the calves, staying hydrated, eating nutrient-rich foods, and keeping your legs moving, you're creating an environment where your body can maintain better blood flow, reduce swelling, and prevent discomfort or complications. Another habit that helps is paying attention to posture, both while exercising and during your daily activities. Sitting with feet flat, knees at a right angle, and spine upright during your calf raises makes the exercise far more effective, and being mindful of posture while walking, standing, or even sitting for long periods can prevent blood from pooling in your legs. Small changes like these, practiced consistently, can make a big difference over time. Consistency really is the key. Just as the seated calf raise requires daily practice to strengthen your calves and improve circulation, combining it with hydration, nutrition, and general movement ensures that those improvements stick and continue to build over weeks and months. You may notice reduced heaviness, less swelling, increased energy, and even improved confidence in your ability to move freely. It's not about drastic changes or complicated routines. It's about creating a holistic approach that supports your body from multiple angles. By integrating healthy habits with this one simple, powerful exercise, you give your legs the best chance to stay strong, energized, and free from the discomfort that often comes with age and conditions like diabetes, making it easier to maintain mobility, independence, and overall quality of life for years to come.